We are TeleSAFE, and we are partnering with hospitals to provide sexual assault survivors the care that they deserve when they need it the most. Following an assault, survivors need compassionate, competent, and timely care. And when survivors feel safe and supported throughout the exam process, their healing journey can begin. TeleSAFE is an on-demand sexual assault forensic examiner program, or SAFE program. It is available to partnering hospitals 24 hours a day, 7 days a week, in performing forensic examinations and collecting DNA evidence. This is all done via remote consultation between your medical care team, your patient, and our providers. Our team of TeleSAFE consultants is comprised of highly trained and deeply experienced sexual assault forensic examiners, each with several years of experience. TeleSAFE can support a hospital's unique needs with or without an existing SAFE program already in place, and is equipped to support both adult and pediatric cases. For hospitals without an existing SAFE program, we can support any nurse with step-by-step instructions to perform these detailed exams while ensuring the patient feels supported and knows they are in control of the process at all times. If your emergency department has a SAFE program, we can support your team in any way that is helpful, such as filling in any coverage gaps if you lack 24/7 coverage, or providing a second opinion to your experienced providers. It is always our goal not to take over the exam, but to assist in any way that is helpful. Here's how TeleSAFE works. When a patient enters your facility seeking help after a sexual assault, they are triaged and moved to a private exam room. Your hospital will then call your local advocacy program to ensure the patient has an advocate present. Your hospital staff will then call TeleSAFE and talk confidentially with one of our skilled professionals who will gather basic information about the patient. When we are ready to begin, our on-call provider will help your hospital nurse log on to the secure, HIPAA-compliant TeleSAFE video conference. Together, we will discuss how certain situations may be handled during the exam, and we will answer any questions your nurse may have. Your nurse will bring the video device into the exam room and introduce our provider to your patient. Together, we will obtain the patient's consent, ensuring they are fully informed and understand each step of this process, including the kit, possible medications, photos, and their options for release of information. Most importantly, we will make sure the patient knows that this is their exam and they can decline any part of the exam at any time, that they are always in control. Then together, your medical provider, the patient advocate, and our TeleSAFE provider will complete all parts of the exam to which the patient has consented. This may include recording the patient's medical history, documenting the history related to the assault, taking photographs of any findings from the head-to-toe exam, gathering forensic evidence and possibly a drug-facilitated kit, performing the speculum portion of the exam and taking photographs of any injuries, collecting any necessary lab work, and ordering appropriate medications for emergency contraception, HIV post-exposure prophylaxis, and to help prevent sexually transmitted infections. After the exam, our TeleSAFE provider will help your ED staff complete all documentation and make sure the chain of custody with all evidence is properly maintained. Every aspect of our program has been carefully and thoughtfully designed to assist your medical team in providing the best possible care to sexual assault survivors. Partnering hospitals are supported by a dedicated TeleSAFE professional through all elements of implementation and ongoing partnership, including tailoring the program to support your hospital's unique needs. We work with everyone involved in the process, including the emergency department administrators, nursing, medical records, nurse education, and IT departments. We will also help share the news with your community to ensure that they are aware that these services are available locally. To learn more, visit telesafe.org or call 1-833-TELSAFE.